Hi, everybody. This is the Dr. Debunk weekly podcast show. On this show, I'm going to be debunking the medical myths, garbage, and crap that's spread by doctors and other health professionals. Dr. Debunk is the medical truth teller. Okay, everybody. Today's podcast is going to be a Professor Debunk podcast. Well, Professor Debunk is going to be doing strictly educational shows. And I'm going to try to do one a week or every 2 weeks at least. I'll do more and more of them because you people need to be educated about the medical connection to things that make you optimally healthy. So today you're going to do a little medical education seminar. Anyway, so today's subject is vitamin D. Now, vitamin D has been in the medical news for 15 years now. Now, that's unusual, which I'll say why in a minute. And the reason we started looking at vitamin D is because about 15 years ago, we began to see clinical vitamin D deficiency. And we saw that it had some kind of weird role in heart health because vitamin D was never associated with that. And so ever since then, doctors have been studying it. Well, mostly medical researchers. But it also really got into clinical practice. And you have to understand that's very unusual because doctors, we don't care about vitamins or minerals. We do drug therapies. We're not interested in vitamins because you don't really change people quickly manipulating vitamins. I mean, we don't even care about hormone therapies really because hormones aren't drugs. I mean, it sounds weird, but we study disease, not deficiency of anything. So hormone deficiencies, precursor deficiency, nutrient deficiencies, vitamin and mineral deficiencies, they're outside the scope of medicine. I mean, we only mess with them when they're extremely low when we do blood testing. I mean, other than that, we don't really care. But that all changed with vitamin D because we started to see this relationship with actually younger women being deficient and connected to heart problems and other issues as well. I mean, your perception of pain is connected to your vitamin D level. Fibromyalgia is probably connected to it. And there's more. But anyway, it started 15 years ago, this medical research machine that we've never done with other vitamins. And it's just been going and going since then. It's been a worldwide phenomenon. And so I think now that after 15 years of it, especially with the last couple years, the newer studies, what they're showing, to me, it's really revealed, what's going on here, how this all works. Because researchers have probably been more fascinated by this than practicing physicians. So there's a lot of studies. I think we can come to some very important conclusions about it. What we've really been doing here that's really unique is that we're using vitamin D replacement as a therapy in the same way we do drug therapies. I mean, we're giving a lot of it. And I'm not complaining. I mean, it's just unusual for us to do this as doctors. But it's really good that we have. So, at this point, we know how to give vitamin D. We have a good idea of what blood levels should be, which you got to understand, we've never done that for any nutrients. Almost all nutrients, we don't know what optimal levels are. But we do now with vitamin D. But now we know the mechanism of action or how it works in the body. It's all pretty clear, well, at least to me anyway. So that's what we're going to go over. It's not very long. It's pretty straightforward. But there's a lot of background that you have to understand. So it's going to be a lot more complex than I'm going to express today, but the basic principles are here, and now you'll understand it. Okay, so what does vitamin D do? Well, everybody knows, because we've heard it forever on the TV, that, vitamin D has to do with strong bones. The regrowing of our bones has to do with calcium, and it's all very laid out and specific. We've known it for 50 plus years. But now, to come right to the conclusion, we realize it builds strong blood vessels too. That our blood vessels are being rebuilt by vitamin D in the same way vitamin D has done with bones. And it has to do with the linings of our blood vessels. Now, the lining of all our blood vessels is called the endothelium. And we're understanding that vitamin D levels determine the efficiency in a major part of rebuilding that lining, the endothelial lining. And the other thing we see now that's very unusual and quite remarkable is that we see that the inflammatory response is greatly aggravated when you're deficient in vitamin D or when the blood vessels are damaged. And therefore, there's an effect on healing, which I'll get to. So I have to back up a second because you have to understand a little bit about blood vessels and inflammation. So our blood vessels have always just been thought of as being the highways that carry the blood and the blood components everywhere in the body. But it's much more than that. Our blood vessels are an organ system that has a function beyond just being the highway and carrying the blood components. Now, it's beyond the scope of this discussion, but it's a functional organ just like your pancreas is a functional organ. So your pancreas makes insulin and other hormones. Well, the blood vessels do other things too. And we're just beginning to get some of the understanding of that. And through this, it's becoming more clear about vitamin D. And that's what's happened in the last couple of years with vitamin D and chronic inflammation. The way our body causes chronic inflammation and manages chronic inflammation is affected by vitamin D levels in the tissues. So, acute inflammation is one thing, and chronic inflammation is another. And so, let me explain this a little bit. Because we never had any idea that vitamin D was involved in inflammation at all. Now, inflammation is a vast set of complex metabolic reactions in the human body. And I emphasize the word vast. It probably took 30 years of effort for us to even understand it. And so we have a good understanding now. What we don't understand is the inflammatory control mechanisms. But when I was first a doctor, of course, that was back in the Stone Age when the dinosaurs roamed, we thought all inflammation was bad. Any degree of inflammation was a sign of abnormality. Well, that's not true. And by the way, inflammation is not the same as swelling or edema. Swelling or edema is just extra fluid that, say, leaks out into your tissues. So, for example, you sprain your ankle, and the swelling you see is excess fluid from tissue damage. That's not inflammation. Inflammation is a complex set of chemical reactions in the body. And so now we've come to realize that acute inflammation is a normal response to all stressors, and chronic inflammation is what's bad. And chronic inflammation, simply put, is just leftover acute inflammation that hasn't fully resolved. Acute inflammation is normal, caused by all stress, low grade or intense. But chronic inflammation is abnormal that occurs when you can't fully get rid of the acute inflammation, as I just said. So, for example, if you have a traumatic injury, not only will you see swelling, but internally, within your bloodstream, there is an acute inflammatory response, and that starts the process of the body recognizing something was damaged, and so it's got to fix it, and this whole cascading thing goes on, and then in the perfect world, under 25 years old, that acute inflammatory response will go away, and then you'll fully heal. And so if you were, 30 years old and you dug up your yard, pulled all the weeds out, you would get better very quickly, your knees. But if you were 60, it would go on. And that's because that leftover acute inflammation becomes chronic and never goes away. Now, there's a lot more to it, but that's kind of an overview. And this really starts you, generally speaking, in the mid-40s, where we don't get rid of all the daily, weekly, monthly inflammation. So that means your stress tolerance gets less and less. Your repetitive work ability gets less and less. This is where the aches and pains of aging come in, because they're not natural. We always used to think they were, but they're not. The aches and pains of aging occur because of chronic inflammation. Okay, so let me kind of bring this back. This response happens to every organ of your body at a different rate. So we think in terms of our muscles and bones. But your pancreas, say, is inflaming with age. Well, why? Well, because let's say at 50 years old, you go out and carb load like a maniac on a holiday. On a holiday weekend, you eat tons and tons of carbs. Well, that stresses the snot out of your pancreas to make enough insulin and the other hormones. So that causes to have an acute inflammatory reaction. And then because of your age, due to a lot of factors that I won't explain, the acute inflammatory response doesn't fully go away, and so there's leftover inflammation that becomes chronic. Well, chronic inflammation causes degeneration. Chronic inflammation is the main driving force for degeneration. And degeneration is just another name for disease. Well, now we realize that the blood vessels themselves are having the same thing happen to them. And for a lot of reasons, which I won't get into. But it's the same process for the organ system that comprises our cardiovascular system, or the heart and the blood vessels. Now, when blood vessels get inflamed badly enough, acutely enough, in medicine, we call that vasculitis. But what I'm talking about is the low-grade, little bit of vasculitis that every day, every week, every month keeps accumulating. You don't feel it. We can't measure it. But that is causing a slow degeneration of our blood vessels. And so with age, the chronic inflammation of our blood vessels is wrecking them. Well, that's catastrophic. The implications are vast and catastrophic because that's going to compromise your circulation downstream. That means the terminal capillary beds, or the final capillary beds where all the food and oxygen gets exchanged, they're being destroyed first. Well, as I talk about in another lecture, you have 100 billion terminal capillary beds. 100 billion with a B. And I talk all about that in another podcast on chronic inflammation and the circulatory theory of aging. And there's more details. But here's the bottom line. Here's the punchline. Here's where I've taken 8 minutes to explain all this. Vitamin D has a direct effect on how blood vessels repair themselves from this chronic, low-grade inflammatory destruction. But it's even more than that, because it also affects how the organs of those terminal capillary beds repair themselves. Now, I know I just said a mouthful. So let me explain it this way with examples. A brand new study just completed showed that the amount of scar tissue that occurs after a heart attack is directly related to your vitamin D level. The higher your vitamin D, the more optimal that makes it, the less scar tissue will form from the heart attack on the muscle of the heart. Well, see, scar tissue is non-functional. Scar tissue doesn't do anything, but it's also inflammatory in nature. So that means if you formed 5% too much scar tissue as the heart healed from the heart attack, it is now permanently 5% less functional than before the heart attack. Permanent. They've just shown this with stroke patients too, that stroke patients have less residual stroke symptoms if they have optimal vitamin D levels. Also, if they're treated with high-dose vitamin D at the time of the stroke. Another study showed already a significant mechanism of action. In other words, how does this work? Well, these things called fibroblasts form scar tissue. They're critical for this. And the right amount of fibroblasts are critical. Too many fibroblasts causes too much scar tissue, which again, scar tissue is non-functional and inflammatory in nature. So all of this has made it very clear, really in the last year, that vitamin D will work its magic through the endothelial lining of the blood vessels in every organ of your body to make sure they correctly heal and rebuild themselves. Because see, I just talked about the heart and the brain, strokes, heart attacks, but this means it's true for every organ in your body. Because every organ in your body is touched by the circulatory system, and every part needs an optimal healing potential to occur, which is now directly related to vitamin D, which is mind-boggling because we had no idea in all of modern science that this was true. So, I know that's a lot of what I just said. So what this means is, the implication is that as people age, everyone should supplement with vitamin D, which is exactly what we're coming to conclusions of in clinical medicine. I mean, in the last 10 years, primary care doctors are checking hundreds of thousands, probably many millions of patients' vitamin D level. Well, we've never done that with any other vitamin. Well, we've done a lot of vitamin B levels, but that's a whole nother story that's been way overused and treated. A lot of patients think vitamin B12 butt shots are magic. It's the magic show. But anyway, as we've drawn all these millions of levels, we see catastrophically low levels. I mean, all the time. It's very common. It's even showing up in young women, which is a whole can of worms in itself. Because young people under 40 years old are extremely resistant to vitamin deficiencies, which is another story. Anyway, the bottom line is, as far as blood levels, what we've realized, if your blood level, say, is minimally deficient in vitamin D, well, then your tissue levels in your body are much worse. Now, I can't explain why that's true, but it's always true. It's absolutely true that the tissue level of any substance in your blood is always lower than what the blood level says. When you're talking about deficiencies, now I'm not talking about too much. I'm not talking about clinically ill people. I'm talking about more or less normal, non-disease people. And that's another podcast. Anyway, with that, it's time for a break from this and a word from our sponsors. Hi, everyone. It's the cold and flu season again. And this year's pretty nasty. Well, do you know what the best cold and flu remedy is? Well, it's a remedy that would be natural, strong, kills viruses, and has some science to show that it really works. Well, that's KSK Cold Spray. KSK Cold Spray is an all-natural, germicidal spray that eliminates cold and flu symptoms in 24 to 48 hours. I proved it in a study of 200 patients, and now we've probably had 700 people that have used the spray. Every year it's curing hundreds of my patients. So don't be miserable anymore. Go to kskcold.com, that's kskcold.com, and you'll love what you read. I'm Dr. Debunk, the medical truth teller. Okay, welcome back. Now, the next subject has to do with vitamin D in our diets, and the history has been in America because of our diets that we've always thought that Americans got plenty of vitamin D. But have we learned differently in the last 15 years? It's just not true. And I'm not going to talk about the different types of vitamin D, D2, D3, the conversion of sunlight, and all that stuff. You can look that all up yourself. The bottom line is we don't get enough. It's still debatable whether you can eat healthy enough to get enough. I'm not taking that chance. I think everybody should supplement. And I think around 45 to 50 years at the very latest, people should start supplementing with D. There's a lot of exceptions. People have to start younger. So we're going to talk about that. Now, as I mentioned, in the last 15 years, we've done a ton of work, and there's a ton of dosing studies on vitamin D. So we really know how to do it. There's a little bit of debate about it. I don't do it the way most doctors are doing it. Most docs give these 50,000 units, international units. Vitamin D doesn't go by milligrams. It goes by IUs. Anyway, we just call it units. Give 50,000 unit, big old, well, they're not real big. They're capsules. And you take it 1 day a week for about 2 months. And when people do that, you usually have enough. You've eradicated your deficiency. But a number of studies have shown that many people over 25, 30,000 units, they don't absorb it anymore. So basically, if you take more than that, a lot of it's going in the toilet. So your vitamin D won't get your toilet won't get osteoporosis from vitamin D deficiency, but that doesn't do us any good. So what I do, and a lot of physicians are doing, is you take 30,000 units 2 days in a row every week for 2 months. Then you would get a blood test, and if your test looks optimal, the hard part begins. I'll get to that in a minute. So, for example, every Monday, Tuesday, every week for 8 weeks you would do it. You would get a blood level to show what we call sufficient. Now, I like levels to be from 70 to 100. Well, that's one measure. There's another measuring that says it should be from 30 to 50. I'll talk about that in a minute. And then the tricky part is, how much do you take after that? I mean, long term. So I have a lot of patients that are doing, at a minimal, 2 days a month, every month forever, 30,000 units, 2 days in a row. I have a lot of people have to do it every other week. So Monday, Tuesday, and then you skip a week and you do it again. 30,000 units, 2 days in a row. Now, the only way to know is to do follow-up blood tests. Some people don't want to hassle that. So if you don't, then you would have to long-term do probably 2 days a week forever, every other week. Monday, Tuesday, skip a week, do it again the next 2 weeks later, Monday, Tuesday, forever. But you really, every once in a while, need to get a blood test. I mean, once a year is the minimum now, I think. Now, virtually all vitamin D, as far as changing subjects now, what type of vitamin D you get, it's almost all D3, which is what you want. And then the second part would be, well, who do you buy it from? What brands? And that is a big topic. So we're going to talk about that, because how do you know it's a good brand? Well, first off, there is no oversight to supplement companies. And what I mean is nobody checks for purity or concentration. There's no laws, there's no rules. It's supposed to be the company's moral value system, honest, upstanding businessmen who will make sure that there's 92% of what they say is in there, and that the product is relatively free of lead and arsenic and strychnine and chromium and all the other nasty things in the manufacturing world that could get into their supplement. My problem is a question, in the form of a question, and here it is. Do we have evidence over the last 40 years regarding American business practices? Do American businesses believe these two things? One, do they believe that if you don't get caught in a lie, it's the same thing as telling the truth? And number two, do they believe that if you as a consumer are stupid enough to pay a lot of money for a low-quality product, that's your problem? That they believe that's your responsibility? I mean, do we have evidence to support those two belief systems? Unfortunately, I think so. So then what do regular everyday people like me and you do? How can we know who's good and who's bad? Well, the starting place is to have a product be verified by an outside testing company. So there's like 4 of them that I'm aware of. United Pharmacopoeia is probably the most famous. So as I was saying, United Pharmacopoeia is one, Underwriters Laboratory, Consumer Labs, and then there's something called NSF International. These are all testing companies that will check the purity and concentration of any kind of supplement product. Now, the most widely used is probably USP. They're the biggest, I think. And so what they basically do is once a year, for a certain amount of money, we'll check a product for you, your product for you. They'll do random samples from the shelves and test it. So, for example, Costco makes Kirkland brand vitamins. And Costco spends the money to verify, I think, virtually all of their Kirkland product lines. And so they pay USP a certain amount of money, and once or twice a year, they will randomly go buy it from Costco and then check it in the lab. If it flunks, they don't get to certify it anymore. If it passes, they do. And so they've been doing this for many years now. So That's one. Now, there's the other three, and Underwriters Lab is a newer player, relatively speaking. Underwriter Lab, that's the little UL symbol you'll see on the back of toasters and computers and everything else, because they've always been kind of an electric quality checker, but now they want to get into the supplement business. So they're going to do it supposedly twice a year, random checking. Anyway, we'll see. They've only been doing it a couple years. So hopefully, these checker companies are really doing it and they're honestly checking the products. I mean, I tend to think so, and here's why. As much as I love to believe in a good conspiracy theory, it seems a bit of a stretch to me that these companies would be getting paid off by the manufacturers, because then they would be liable for criminal fraud. And it's like, why would they do that? Because if you're really going to be criminal in your product, you're going to make a crappy product that's got lead in it, or it's 1/5 of what you say. It's easier just not to verify, because if you don't verify, there's no penalty. I mean, if you get caught, let's say you're going to make a vitamin D product that's supposedly 5,000 IUs, but you only put 1,000 in there. Even if you get caught, there's nothing that gets done to you. There's no laws you're breaking. Now, it's hard to explain all that, but bottom line is, even if you get caught, the owners of the company can't be criminally prosecuted. It's just absolutely legally true. There's no consequence. So that's the things you're dealing with here. And this is why most products are not checked for purity and concentration. So anyway, the bottom line is, you want to buy a vitamin D product that's been checked by one of the companies I mentioned above. And like I said, USP is the most common. You'll see the little symbol on there. Now, finally, I have to say, I don't believe at all any company when they say they check their own products for purity and concentration. I don't believe it. Because of what I just said, there's no consequence if they're not really putting it in there. Because think of it this way. If you buy a vitamin D, like I just said, that's 5,000 IUs, how do you know it's not 1,000, 500? How do you know it's not 100? You don't know. It's got to be checked by a lab who would verify it, and that's about $1,000. If you want to do it yourself, that's what it costs. And so if a company only puts in 1,000 units, well, they can make 5 products for the price of 1. I think it's just too tempting for companies now to cut corners. You can call me a cynic, but I'm sorry, I've lived a long time now. And I see what companies do. And I see that they do generally believe that if they don't get caught in a lie, it's the same thing as telling the truth. I wish it wasn't the rule. I wish it was a rare occurrence, but I just don't believe that anymore. So the best you can do is have some type of outside verification, outside company verifying the product. So that's what you look for. And that's really kind of how this works. I think I'll just do a little summary and then we'll be good to go. So, probably as early as 30 years old, where the research is going, that everybody should get a vitamin D level, a blood level. Because younger generations seem to be getting deficient much quicker. Many docs are starting to routinely check patients in their 30s, women in their 30s and men in their 40s. And so if your blood test is in the low normal range, that means you're mildly to moderately deficient already in your tissues. And if you're below normal, you're moderately to severely deficient. And so you need to supplement. At some point, everybody needs to supplement with vitamin D.